The one thing that was meant to break you had the power to help someone else to survive. Welcome to Healing Through Chaos, the podcast where pain is transformed into purpose through powerful storytelling. It's the one place that you'll find licensed professionals and survivors meet at the same table to talk lived experience and expertise. I'm your host, John Tay, and this is where your healing journey begins. On today's episode, we talk TMJ.Pain with licensed massage therapist, Miss Jessica Cordell. Welcome, Jessica.
Well, thank you for having me.
Absolutely. So a little bit about Jessica. We just wrapped up about her business of the podcast episode, and that'll be coming out. And I asked Jessica to come over to Healing Through Chaos to have a conversation on TMJ pain because she's has so much experience and background in dealing with this. And I wanted to give my viewers a little bit more insight into exactly what this is. So Jessica, you ready to get into it?
Let's do it.
Let's go. So take us back to the beginning of your TMJ journey. What was happening in your life when you first started experiencing jaw pain, and how did it impact your day to day life?
Yeah. So my first experience with TMJ was 2015. I was at a red light and someone rear-ended me going 45 miles per hour. And so sustained pretty severe whiplash. I had pain wise, it was more of my neck pain. So dealing with that dysfunction from the injury. But I quickly noticed within a couple weeks, suddenly now when I was opening and closing my mouth or I was chewing, I had jaw clicking that I never had before in my life. And thankfully it wasn't painful, but it was suddenly noticeable. Something I never dealt with before. So anytime first thing in the morning, those first few times talking, yawning, I'd have a click sound happen in my jaw, but the pain never really showed up after the accident. Thankfully, no pain, but no matter what I did, once opened my mouth to a certain point, I would always hear this click sound happening when I would open and close.
So let's talk a little bit about medications.
Mhm.
Can you talk about your use of antidepressants as part of your treatment journey? And what was the experience like for you physically and emotionally?
Yeah, so my antidepressant journey was I have suffered from severe depression since I was 13 years old, but it was 29 before I began using medication. So a lot of self-treatment, self-sabotage, a lot of that went on. I finally got to a point where I was like, I need help. I can't do this anymore. And for me, mentally, I mean, amazing. I didn't know I could feel that way, having positivity in my life and not trying to hurt myself, sabotage myself, and things like that. I really gave me that purpose to enjoy life again. Now, physically, after a couple years on it, I did start to notice I have motor tics naturally. So, a lot of just muscle twitching that I had prior to my medication use, but I did start to notice that the body twitches would increase. And so it caused me to start having more physical pain because my muscles were always working. But then it started to happen in peer. Now the actual TMJ pain started up because all day long I would tap my teeth together. Could not control it no matter what I did. And so that was just a lot of extra use on my joint, on my muscles, on issues like that. And so I really started having, I would go into the dentist now and suddenly would have gum recession from chronic clenching and tapping my teeth together, something I'd never had before. And now suddenly I'm having these issues with gum recession. And then just at my most recent dental appointment, I they noticed a cracked tooth for the first time. And I was like, what? As someone who's always teaching people teeth apart, lips together, all this great and everything, it really started making me dive down that aspect of how was this connection to my antidepressants that has led me here to this more of this jaw pain, to discomfort, gum recession, cracked tooth, and everything. And that's when I really started diving into that dopamine serotonin effect that we need to get from that medication, but also how it started affecting me physically and creating more an actual TMJ pain.
Oh wow. And it's I'm thankful that you started to notice with the antidepressants that it was causing all these flare-ups because a lot of people who use antidepressants don't necessarily understand what's happening to them in those moments. They just experience all the good moods and just not having a care in the world, and they undercoverly be going through a lot of different things and don't realize it traces back to that antidepressant. So thank you for sharing with our audience on that one because I know a lot of people that take antidepressants and it's causes a lot of different other health issues while they were on it. So That's just a little bit of an insight for on how antidepressants it does help, y'all. It really does. It's people, it can cause different other health issues or flare-ups again. Now, for someone who's hearing the term TMJ or TMD for the first time, what exactly is that? And why is it often misunderstood?
Yeah, so I mean, it's very simple letters. Like there's just one defining difference there. So when someone comes to me and they're like, I have TMJ, I hear that as the templar mandibular joint. So that's the actual joint. And so whenever someone comes to me and they say I have TMJ, me being the lighthearted person that I am, I'm always like, well, I hope we have two. Otherwise, we've got bigger problems. But usually what we're trying to portray is I have TMD, so templar mandibular dysfunction or disorder. So something's going on to actually make that joint or the surrounding areas at that joint be able to cause you pain. And a lot of that confusion that goes in is okay, well, usually it's a go see your dentist because it's up in this area. So your dentist should be able to help you. And your dentist gives you this night guard because you're clenching and grinding. That's the end of it. And if you try to start out, you go to your primary care doctor and they're like, yeah, I don't know what that is. Go see your dentist. Or you go see your chiropractor or PT. Your dentist usually is night guard, Botox, anti-inflammatory, soft food diet. So that's usually the biggest, most common solutions around that there, which can be great for a temporary, an acute flare up when things do happen, but it's not long term. It's not going to help you long term. And that's where that frustration gets. It's like, okay, I know how to treat something when it flares, but why do the flares keep coming back? And that's where people get stuck in the medical field of who can actually help them long term with their TMJ pain.
Absolutely. And that was a perfect example of how it pretty much goes in the healthcare field. You go to all these different doctors and they end up sending you to the dentist because, of course, it's dealing with your mouth. So they automatically think, oh, that's a dentist issue. And then the dentist, they give you these guards and you're doing it for a while. And then you realize, hey, there's a little bit something else going on in there. So that's literally where Jessica comes in at, y'all, because she has a whole lot of experience in this field. And speaking of experience in this field, let's talk research for a minute. What does current research tell us about connection between jaw pain, muscle dysfunction, breathing patterns, and overall body health?
I mean, that's a great question. The research will bring up, oh, muscle dysfunction can cause TMD or injuries, accidents can cause TMD. But it's a lot of back to that. Okay, here's these possible causes. Let's go back to the same solutions of what your dentist will usually do and everything. So the research is there. Like if you go to the National Institute of Dental and Craniofacial Research, you go to the National Library of Medicine, PubMed and everything, you put in TMD pain. It's a lot of background. What's the joint? Here are some causes, but then you're still left wondering, but what am I supposed to do after this when it comes to that research?
Wow. And again, let's talk about the years because why do so many people spend years treating symptoms without ever discovering the real cause of their TMJ pain?
Yeah, so a lot of symptoms can end up you're not realizing that it could be dysfunction that's leading to the joint pain, but it's usually a lot of coming from other places of the body. I always refer TMJ pain a lot of time it's just the victim of something and it's just being affected by a bigger problem that's going on. It's usually just your joint's going to be the one that finally yells the loudest for you to finally pay attention because we have, common symptoms that people report all the time. I have jaw pain, I have clicking or popping in my joint, facial pain. A lot of people report ear pressure, fullness, those things as well. But then when we look at less common symptoms like ringing in the ears, eye pain, throat tightness, all the way down to pelvic floor dysfunction. And so you can see we're getting farther and farther away from the joint and so we're focusing on that instead. We're just focusing on that little area instead of connecting the dots to like, okay, here's this dysfunction, this pain, this flare you're having. How could it also be connected to our joint as well when it comes to that there? So we're back to that. Okay, I've got to see a pelvic floor PT. I got to see a neurologist. I've got to see a physical therapist. And so they're all treating the symptom from where you're telling them it's bothering you, but we're not connecting the dots back to how this could have contributed to your TMJ pain.
Oh, wow, and I would have never thought pelvic pain and all these other like ears ringing that actually contribute to the symptoms of having TMJ. And so thank you again, Jessica, for going into that deep detail because a lot of people out there, they may experience certain things and think it's something else, like you said, and end up going to another doctor, and that doctor just does not, well, they can treat it, but it does not necessarily get to the root cause of what's happening. And so that's literally a point to make because a lot of people go and just focus on that one pain that's hurting them that specific moment. When in reality, it might be something else that's going on in there. So thank you for giving all those different examples because I would have never thought that those were some of the examples. Now let's talk trigger and symptom. What are some of the most common triggers that can cause a TMJ flare up, even when people don't even realize it?
Yeah, I mean, we say it all the time. It's always the most common one, but stress can be a trigger. The stressful day at work, the stressful day at school, financial stress, emotional stress. When we go into that stressful fight or flight mode, our body is like it wants to prepare for impact. And so it's got to protect the most vital areas. And that's a lot of the head down our mid body there. And so you get a lot of that, oh, shoulders up, clench my jaw, start to breathe a lot faster, more upper chest breathing. And so that can lead into a lot of jaw pain and dysfunction that we have there. We touched on it briefly, common medications. So not only antidepressants, so those common SSRIs, NRIs, but also just a lot of medications that a side effect can be dry mouth can also be contributing to your TMJ pain. And a lot of medications out there create that dry mouth effect. We've got airway issues. So people with sleep apnea, upper airway issues as well can be a contributor for it. Our posture. So not only our posture sitting at the desk, you hear it often referred to as that tech neck, so head down, doing things like that, but also our oral resting posture. So when we're at rest, not talking, eating, or drinking, that tongue should be gently suctioned up to the top of the mouth. Teeth should be 1 to 3 millimeters apart, and our lips should be gently resting together. So that's a part of your posture. A big one that I see in my patients that come in are that hormones. So during a monthly cycle leading up to it, how our estrogen, progesterone changes, as well as that relaxin hormone, that can start creating some instability. But we also have for a lot of patients who start seeing me in that perimenopause and menopause level where the estrogen, progesterone, testosterone, their levels are just doing a lot more of a drop, they start to see more issues with their jaw pain. And of course, with just daily habits and routine. A lot of us are a lot more inside on a computer, looking down at our phones. So a lot less movement is happening. So when I tell people good posture is important, that doesn't mean sitting up straight for 8 hours and doing nothing else. It's about being fluid with your posture. So instead of being stuck in a posture, what's your movement? What's your posture habits throughout the day? That can be those big contributors to your jaw pain.
Wow. And again, Jessica, she gave some great triggers and stress. It could lead to a lot of different things, but I never thought it could lead to TMJ flare ups. So again, Jessica, thank you for opening the eyes of my viewers out there because again, you may think it's one thing, but it might be something else. So if you are experiencing any of those symptoms, and I will ask you a little quick follow-up. Have you seen a combination of people having all these symptoms, or is it just normally one of them, like stress or just sleep apnea?
It's a combination of everything because with the stress sleep apnea, we think, oh, stress is when I'm awake and I'm aware of it. But stress can come during a sleep apnea event. So when you have a moment in your sleep where your body's not breathing and taking in air, it's going to go into a fight or flight stage because it's suddenly very stressed out that it's not getting oxygen. And so all night long, when we're having these apnea events, you're now experiencing that stress throughout your night as well. And you're not getting your restorative sleep that you need to feel better when you wake up in the morning. So stress doesn't have to be when you're awake and present of it. If it's related to that sleep apnea, your body's in stress. Those 6 to 8 hours that you're in bed when you're supposed to be rest and digest and recovering, it's fighting all night long and keeping you in that stressful state as well.
Oh, wow. And again, you just opened my eyes to something because I didn't even know you could be stressed in your sleep.
Right? I know, right? You're not supposed to, but it definitely can happen.
That's gonna open a lot of people's eyes too. So y'all, you could be stressed in your sleep. So definitely, if you feel like you're experiencing these symptoms, definitely hit Jessica up or hit someone up that is licensed in this field, because I'm telling you, what you may think it is, it might be something else that is the root cause for it. So let's talk about it. And I think we have hit on this a little bit, but what symptoms should people be paying attention to that actually may be connected to TMJ disorders?
Yeah, the most common ones, if it's right here, a lot of people report it right in this area is where they're feeling it. So that jaw pain or aching, if we are clenching, doing a lot of that, it's usually a lot of pain coming from the big masseter muscle and your temporalis muscle. So a lot of people reporting headaches, tension. Oh, I don't feel like I can open suddenly because there's just so much tension that's going on there. And if it's more of a nerve pain, people will report a shocking zinging pain down like the side of their face. And so we know it's can be more of like a nervy issue going on there, but it stays here in this area that we have going on. But popping and clicking. I open my mouth, I close my mouth, it clicks, it pops. Sometimes it makes like a crackly sound when I'm moving it around. Very common symptoms that we have going on there. Overall facial pain can be really common as well as headaches. So if you're someone like, man, I always have a headache on the side of my head there, that can really often come from that temporalis muscle because it's one of our big chewing muscles that closes. And if it's always on because those teeth are touching, that can create a lot of those headaches on the side, as well as that big popular SCM muscle we see down the side of the neck. This one has a really common referral pattern that can actually go up the side of the face and all the way and wrap around the back of the eye. So it's where people are like, my headaches are here. I massage here, 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 but it doesn't get any better. That's when we start looking at more into neck issues, cervical, instability, because it could be referring from somewhere else that you're suddenly noticing it. So tooth sensitivity too. My teeth feel like they're sore and achy. When those all night long or throughout the day, if you're clenched down really tight, it can make your teeth feel like they're almost like bruised, like a bruising sensation.
Jessica giving a lot of detailed information out there. It's more common than a lot of people realize, and a lot of people just ignore it, especially when it comes down to the stress, when it comes down to the headaches, the clicking of the jaw. Some people just think, oh, well, I'm getting older.
Oh my
In
goodness.
reality, it may be very well you're going through those experiences. So reach out, because we don't want to leave anybody behind out there. We want to make sure that you're getting the best treatment as possible. And Jessica has a reference list that is longer than the Nile River. Now, we just talked about stress, and it gets blamed for absolutely everything. So, what are some of the overlooked contributors to TMJ pain, such as clenching, tongue posture, breathing habits, or sleep issues that you've seen?
Yeah, so when our I think a lot of people are surprised that your teeth should only touch when you are chewing and swallowing. Otherwise, they should have a 1 to 3 millimeter space between them because the second those teeth come together, they turn on the big chewing muscles. So your masseters and your temporalis muscle. So that contributes to a lot of pain and dysfunction because you're using those muscles nonstop. And so we've got a lot more of a muscle dysfunction, but it's where you can injure a shoulder, you can injure a knee and still use the other side. It's not going to really affect how you use your other joint in your shoulder or your knee, but your jaw is the only area where if one side is dysfunctional, it's going to affect the other joint now. And so it's why you don't want to ignore it. Popping and clicking is normal. As someone who's hypermobile, my body pops and clicks all day long. So it's not like, oh my gosh, a pop happened in my jaw once. It's the end is near. Everything's going to go downhill. It's just a sign like, okay, something's happened, but did it cause you pain? Did the injury happen? Something like that to be able to address that as well. So you just want to be an eye on it. The tongue posture. I'm sure a lot of people are starting to see it on social media a lot. Where's your tongue? Where's your tongue? Well, the tongue's one of its job is to stabilize the lower jaw. So when that tongue is resting up gently in the palate, it's going to give a lot less movement to the jaw. It's going to help it keep it nice and stable. It's not going to have mouth open posture that we see a lot, mouth breathing. When we're having any breathing dysfunction and we're doing a lot more breathing through our mouth, we tend to notice more short, shallow upper chest involvement. And when that involvement happens, A lot of work can come from the SCM, the upper traps, because they're lifting the shoulders up when it should be the diaphragm muscle doing that job, helping you breathe. And so now we're again back to a lot of muscle dysfunction. When muscles are doing a job that they're not really made to do, but they can compensate to get a job done, they can start having referral patterns into the area. So even, oh man, my upper traps are sore, my neck is so sore. Those muscles could be contributing to some of your jaw pain because of referral patterns we chatted about a little bit when it comes to trigger points there. So little daily habits that don't seem like too much or posture habits throughout the day can really start building up over time to start creating those TMJ dysfunction.
Absolutely. And I got on shoulder pads today, so it looked like my shoulder's sitting up here. But really,
Gym all the time.
this is why I love Jessica because she comes on and she makes me feel normal because I was always one of those people who tongue would just naturally rest at the top of my mouth. And I was always one of those people that didn't like that always hold my mouth like this with the teeth clenching. She always has a way of literally making me feel like I'm doing the right thing, especially when it comes to my mouth, because I always thought it was weird because I didn't see anybody else doing it. And so that is literally why I brought Jessica on because I know it's other people out there that does the same thing and don't know if that's considered normal or not. The professional herself just told you that it is normal for you to be like that and it is a natural resting posture for your mouth and it deserves that. But I see a lot of people that are literally in this mode all day, literally just clenching their teeth. And I'm like, that doesn't hurt. And
Right?
sure enough, I've asked a couple of people, yeah, it hurts, but if I do like this or if I try to separate it, it gets worse. But I see a lot of people that does that, and I see a lot of people that are afraid to actually let that tongue rest at the top of their mouth. They prefer to keep it centered and moving around and things like that. So thank you again for helping me understand that I'm normal out here.
Absolutely.
Now, of course, y'all know on Healing Through Chaos, we always talk mental health. So, of course, I'm going to ask Jessica a little bit about mental health. So, how does living with chronic TMJ pain affect a person's emotional well being and quality of life?
It's like any other chronic pain. It's something that's constantly there. It's in the back of your mind. It hurts throughout the day, and that can limit your quality of life. Not only is your nervous system always on because it's thinking about all this chronic pain, but it starts to affect you even socially. We need to talk, eat, and breathe. And so much of that comes from being able to use this area. And I've had several patients who don't go out anymore because it's too painful or uncomfortable to chew their food. And it's awkward when you go out and everyone's ordering something and you're like, oh, no, 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 I'm fine. I don't need to do it. Or the other way, they go to eat their food and everyone stops and stares at them because they heard the loudest click sound possible when they're trying to open really big to be able to eat something. And now they've got to sit there and explain, well, okay, why does my jaw pop and click so loud that you're able to hear it three chairs down from each other? And so we start to get people isolating themselves, and that starts to affect their mental health because they're so concerned about it. How many times do you end up being gaslit by providers of, oh, it's just stress, anxiety. Have you tried diet and exercise? They're not really taking a look, addressing the issue. And you start to believe yourself that maybe you are crazy because no one's been able to help you. You find all that. And so you just have all these different aspects coming in personally, socially, in your health that it's just mentally exhausting, and you start to isolate and be inside yourself, and you start to second guess who you are these days when you're not having anyone around you anymore.
Wow. And a lot of times people do go through things alone and just feel like no one understands out there. Let's talk about connection for a second. Have you seen a connection between anxiety, depression, or nervous system dysregulation and the intensity of TMJ symptoms?
Yeah, absolutely. A lot of the anxiety, depression, more of those symptoms I see coming from the side effects that we chatted about earlier of how it can cause more muscle spasms and things like that. So giving more of that physical aspect of it is of that as well. But again, that fight or flight, that nervous system dysregulation. So people, your body doesn't know the difference of being chased by a bear and being in rush hour traffic. It's going to respond to the same level of threat with it. And a lot of that can be clenching and bracing. A lot of that can be more open mouth posture breathing, more upper chest shallow breathing. And that can lead to a lot of chronic muscle dysfunction, those issues as well. But the problem is, we don't turn that fight or flight response off often. We can get stuck in that fight or flight response. And so now your nervous system is always on guard. It's always bracing. It has more of the upper chest shallow breathing, and that doesn't stop. And then you can have all of that again happen now at nighttime when you're sleeping. If you're having sleep apnea events, a lot more of that response too comes in when I see it with patients going through perimenopause and menopause, when there's these big fluctuations suddenly happening in our hormones. You hear a lot of women who are just having normal monthly cycles, that 7 to 10 days leading up, suddenly the world's on fire, everything's awful, little things that never bothered you are suddenly the most extreme when it comes to it there. So a lot of hormones get involved into this as well. And so when you're going through these constant chronic fight or flight modes, you're going through this up and down roller coaster ride as your hormones, you just become dysregulated in your nervous system. It's exhausting after a while dealing with that.
Absolutely, absolutely. And we could talk nervous system regulation all day because that's one of those things that have been seen commonly, especially in the healthcare field as of recent, and finding all the different ways to treat it. But for the sake of today's episode, I ain't gonna take y'all down a pipeline. So, what would you say to someone right now who feels exhausted, frustrated, or hopeless after years of searching for answers and not finding relief?
When those patients come into my office, my first thing is I'm sorry because you need to be validated. Like, you're here now. I'm sorry other providers have not listened to you, have not helped you, but there are providers out there. And so if you feel like, well, I've exhausted my list. I've seen the dentist, the PCP, the therapist. I'm all the these list of medications. I have all of this there, but no one's asked you, how's your sleep? How has that been for you? Have you had your hormones tested recently? Getting a true evaluation of our muscles working up here. I work a lot in the EDS and hypermobility population. So, how much of your body is working overtime on the inside to just bring you the bare minimum stability? And then you're asking your body to still provide for what it needs the rest of the day, for the movement, for the function that's needed there as well. So if you feel like you've exhausted everyone at this point, massage is great, but it's short term. PT is great, but it didn't give me a lot of the long term function. They gave me the pain meds. I'm going outside and getting my 10 minutes of sun. There's a lot more. And I know it feels like, well, there's no one else out there. We are out there as providers. We're just not as seen when it comes there. So, no, if you feel like you've hit a wall, you feel like you've exhausted your list, we're out there. It's taking that extra advocacy for yourself to be able to find us providers. And that's what we're working on in social media and networking on connections. I network with physical therapists, not just dentists and things like that, sleep doctors. I'm networking with everyone because you just don't know where that connection is going to happen when it comes to working with providers or patients in that area.
Absolutely. And again, call Jessica because Jessica has resources, she has connections, and she will get you the help that you need. Whether if you're in her state or not in her state, she will help you. Now, of course, people want me to talk about treatment and recovery. So let's get into that for a second. What are some of the most effective treatment approaches available today for people struggling with TMJ disorders?
The most effective, I feel, because everyone's what's covered by insurance, if you can, finding a physical therapist who's TMJ informed can really beneficial because we see a lot of TMJ disorders coming from more of a muscular structural pattern, things like that as well. Working or finding a dentist who doesn't just say, oh, here's a night guard. I always tell people find an airway focused dentist or orthodontist. They are going to listen to you when you come in about jaw pain because they're going to dive down several other avenues that got you to having that jaw pain there. So, massage therapists are great. It's conservative care. Yes, it may be short term, but it can help you get by until you can get into those next providers. So, those three there are people you can see them now. until you're able to dive a lot deeper, and there's going to be a rabbit hole that you're going to go down. I know I always tell my patients, I'm like, how much time, finances, and energy do you have? Because this can go on for a long time. But very basic, accessible providers, airway focused dentist and orthodontist, physical therapist informed in TMJ dysfunction, and then finding a good massage therapist as well, especially if you can find one who can do intraoral work for you.
Absolutely. I love that she included the professionals and the titles and certifications and history because a lot of people out there is going to go, Jessica, what do they look like? What are their names? And Jessica just gave them to you. So if you have any of those providers in your area, reach out to them until you're able to get to that TMJ specialist because it can help you in the short term until you're able to get to that person that can help you in the long term. Now, how do practices like jaw exercises, tongue posture training, nasal breathing, massage therapy, and nervous system regulation help reduce pain and improve function?
Yeah, so things like the jaw exercises, tongue posture, that's really helpful if it's coming from a muscle dysfunction. If muscles are not working together, they're not coordinating together, or other muscles are having to compensate because there's limitations, that really helps on the muscular side of everything. Nasal breathing is wonderful because if we have that true tongue posture up, lips together, breathing through our nose, it's going to help with us staying in that rest and digest, that parasympathetic breathing. So a lot less to dysfunction maybe coming from up here, a lot of muscle dysfunction. Massage therapy is wonderful. I mean, a lot of the world is lacking human touch and interaction. Massage therapy can bring that to you. Working on the muscles when you're doing that as well. But the biggest release that I see for people coming in for my body work is for just 90 minutes, getting your mind out of that fight or flight, that nervous dysregulation. And there's a reason you fall asleep during a massage because your mind can just stop and take a break. So, having that aspect of it, of someone working on the areas that are really bothering you, reminding that nervous system, this is okay. This touch is safe. You don't have to be so hyper alert in this area. Take a little break when it comes to that as well. All of those little things can really help not only with the nervous system, but the muscular dysfunction that I see often for people with TMJ pain.
Absolutely. And I do want to get some advice from you before we go. For someone who is listening right now who may be in the middle of a pain flare up, what are a few practical steps they can begin taking right now to start calming their jaw and supporting their recovery?
Yeah, I mean, we know self massage is a really great tool to be able to use. If it's more muscular, man, my muscles are sore and achy. I feel like they've been in a workout, applying heat, wet, moist towel, things like that to it, then doing more of that. If it feels like it's coming more like if you were to put your finger inside your ear and massage right where that joint is, and it's like, ooh, that hurts. It's a zinging sensation. You can do ice right around this area too, because if there's inflammation in the joint, then that ice can help calm that inflammation down and make it a lot easier. Very gentle movement. Absolutely. If you are in pain, using incense, Tylenol, using things like that, if biting something into food or crunchy food is causing you a little bit of that, but you don't want to make it long term. You do still want to move. We don't want to just go on lockdown. Don't move, don't eat this, don't do that, because then it's a lot harder too for your nervous system to associate, oh, these patterns are absolutely negative. We're never going to do them again. And if you try it, I'm going to go from a 1 to 10 really quick when it comes to these issues here. So it is taking it easy, doing those, techniques there, but don't stop. Get back into it once that acute pain starts to calm down there, because the last thing you want to do is to stop moving when it comes to these issues.
Absolutely. And always remember that is temporary support. Make sure that you're setting up those appointments to get the help that you need. And sadly, we have come to the end of today's episode, but I want to ask Jessica before we go, how do you hope your story and work you're doing inspire others who are living with chronic TMJ pain and searching for hope?
There's people out there who can help you. So if you feel like you've seen everyone and no one's been able to give you more of those long-term solutions, we're out here. I'm sorry you've had to experience that. A lot of people who are the most helpful are the people who have gone through some of this experience themselves. And so it is trying to weed out and finding those right providers, which is exactly why you don't have to live in Colorado. You don't have to, you can meet me virtually and be like, hey, but I want to work with someone where I'm at. I'm going to help you find that. So you can find those providers there. And there's plenty of other providers who, once they have their network built up, they can really help you. But unfortunately, right now, we can be a little bit harder to find. But we're there. There are people out here who can help you through this.
Absolutely. And I have enjoyed having my girl Jessica come on today because she's brought all the examples, all the work, the background, and the reference list, y'all. Don't forget about that.
Yeah.
And I hope that she has enlightened everyone on the difference between TMJ.Pain and TMD. So, you guys, once again, I'm going to say it again. If you feel like you're experiencing any of the symptoms that we have talked about today, or a combination of these symptoms, please, please, please reach out to those professionals that can help you, and specifically Jessica, because she can help you no matter what state you're in. But I do want you to let everybody know the name of your business, where they can find you, where they can sign up, and all your social media so people can follow you. Let us know all the details.
Yeah, so I'm located in the amazing city, Denver, Colorado. So my private practice here, if you're wanting to do the massage or if you're wanting to do the myofunctional therapy in office, you have that a way to see me. If you can't, you can book a free discovery call on my website, tmjology.com. I also post several times a week on my Instagram. So my handle there is at tmjology. And I just post often throughout the week tips, suggestions, symptoms, who you need to go see about everything is just a free resource for you to be able to use as well.
Absolutely. And if you can sign up for her course, because she has a wonderful on demand video that talks a lot about TMJ pain. And if you guys just want to know a little bit more insights, whether if you're a professional or just a person that may know someone who's going through it, definitely look into that as well, because the video is absolutely outstanding. Any last words before we go today, Jessica?
Thank you again. You're always the best host. I absolutely love being on your podcast. You always ask the most amazing questions, and you are helping so many people learn more about themselves and how they can truly get help. So, thank you again for having me on.
Thank you again for being here, Jessica. And thanks again to licensed massage therapist, Miss Jessica Cordell, for coming on and sharing her personal insights and story with us. And you be sure to subscribe if today's message resonated with you. Also, leave some comments down in that comment section. Until we meet next time, keep your healing intentional, your boundaries solid, and your peace protected.